Okay, my name is Melanie. I'll be your RN today. I'd like to help you get to the bottom of your problem. I do need to ask you some questions, and I'll need to do an assessment, which will require me touching you and using equipment possibly to do an assessment. This may take about 30 minutes. Is that okay?
Yeah.
Okay. Let's first get started with a little history. Do you have any allergies?
No.
Okay. Do you have any medical history?
No.
Okay. Are you taking any medications?
No.
Okay. Your parents, do they have any medical history?
Both my parents have high blood pressure.
Okay. What brings you in today?
Been feeling fatigued lately.
Okay. And what do you mean by fatigue?
Just tired all the time.
Okay. And how long has this been going on?
About 2 weeks.
Okay. Is there anything that happened around that time that you think maybe could have caused it?
Nothing I can think of.
Okay. Not aware of anything else that you think may have caused it?
Nope.
Okay. Is it severe fatigue?
Yeah, it's pretty severe.
Okay. Is there anything that makes it better?
No, not really.
Anything that makes it worse?
Not really.
Okay. For general, no signs of expressions of depression. So no signs of depression, no signs of anxiety. Do you work around any pesticides or hard metals?
No.
Denies exposure to pesticides or hard metals. Do you have any fever?
No.
Have you had any weight gains or losses?
I've gained about 15 pounds recently.
Okay. All right. Reports increased weight. Reports 15-pound gain. All right. Have you had any Have you had any head injuries?
No.
Okay. Any problems with your eyes?
My eyes feel a little swollen.
Okay. Reports periorbital swelling. Have you had any problems with your ears?
No.
Denies any ear problems. Have you had a runny nose?
No.
Have you had any sinus pressure?
No.
Okay. Denies rhinorrhea or sinus pressure. Have you had a sore throat?
No.
Any coughing?
Nope.
Denies sore throat and cough. Have you had any neck pain?
No.
Any stiffness in your neck?
Nope.
Okay. Denies neck pain and neck stiffness. For respiratory, have you had any shortness of breath?
No.
Do you have any episodes at night where you may go a few seconds without breathing? We call it sleep apnea.
No.
Okay. Any wheezing?
No.
Denies shortness of breath, wheezing, sleep apnea. For cardiovascular, have you had any heart murmurs?
Nope.
Palpitations?
Nope.
Are you having any chest pain?
No.
Denies heart murmurs, angina, and palpitations. GI, are you having any changes with your appetite?
Not really hungry anymore.
And about how long has that been going on?
A couple weeks now.
Okay. Reports decreased appetite for about 2 weeks. Are you having any constipation?
Yes.
Reports constipation. Genitourinary. Are you having increased urination?
No.
Are you going to the bathroom a lot at night?
No.
Denies polyuria and nocturia. Are you practicing safe sex?
Yes.
Have you ever been tested for HIV?
No.
What about a hepatitis panel?
Nope.
Reports safe sex, denies being tested for HIV or a hepatitis panel. Musculoskeletal. Have you had any muscle pain?
No.
Any joint pain?
No.
Denies muscle and joint pain. Hematologic. Have you ever been told you had anemia?
No.
Do you bruise easily?
No.
Okay. Denies anemia and bruising easily. Endocrine. Are you feeling cold a lot?
Yes.
Reports cold intolerance. How long has this been going on?
A couple weeks now.
Reports cold intolerance for about 2 weeks. What is your sleep pattern?
I sleep about 8 hours a night.
Okay. Do you wake up feeling refreshed?
No.
Denies insomnia. Reports fatigue after about 8 hours of sleep. Neuro. Are you having any headaches?
No.
Do you feel dizzy?
No.
Denies headache and dizziness. Psych. Do you have any symptoms of depression?
No.
Do you have anxiety?
No.
Have you had a lot of stress?
Don't really have that much stress.
Hadn't had a stressful event recently?
No.
Okay. Denies depression, high stress levels, and anxiety. All right, I'm going to move on to the assessment if I can. The objective. Facial expression is a calm expression appropriate for the situation. Hygiene, the person appears clean and properly groomed. Hair is groomed. Hearing is appropriate expressions and responses based on what I've said. Level of consciousness, alert and oriented, attentive to my questions. Mobility, the walk is smooth and the walk is even. Mood, the patient is comfortable and interacts pleasantly. Nutrition, BMI is 28, of muscular build but overweight according to BMI. Posture, the posture is erect. Position, the position, seated comfortably with arms resting in his lap. Skin, the color is even and appropriate for racial heritage. Speech, articulation is clear and content appropriate. All right, I'd like to do my assessment. Is that okay?
Yeah.
All right, I'm going to look at your fingernails. All right, the nail beds are pink and capillary refill, rapid capillary refill. All right, if you can do this for me. Negative for clubbing. Okay, thank you, Mr. Kim. All right, nail thickness. Nail thickness increased. All right, skin, no evidence of lesions, pruritus, no. Let's see. No lesions, pruritus, no redness. All right, Mr. Kim, my plan is to check your deep tendon reflexes. I would also like to draw a blood level called a TSH. That stands for thyroid stimulating hormone. And I would educate you on a diagnosis of hypothyroidism. We would also discuss a medication called Synthroid that we may start. What I'd like to do is draw that blood today, and then when I get my level back, I'll give you a call, and we may start that medication if your level is low. Okay? Do you have any questions?
Nope.
All right, thank you, sir.